37 doctors at Sir Ganga Hospital have tested positive for coronavirus. The hospital has now launched contact tracing exercise and is trying to find out the possible cause for the spread among the doctors. Joining us right now is Dr. Sujay Shah, the cardiac surgeon at Sir Ganga Hospital. Dr. Shah, thanks very much for speaking to us. My first question to you, how many doctors have tested positive and what is their condition at the moment, sir?
We have 37 doctors who are RT-PCR positive. 5 have been hospitalized mainly because of concerns regarding home isolation and concerns about comorbidities. None of them are in a serious condition. All of them are very stable. The other 32 people are home isolated and doing pretty well. There is no case of serious corona and no case where the person has required intensive therapies.
Right. That's good to hear. There is no serious case over there. But doctor, had these doctors taken both the doses of the vaccine, in that case, how come so many of them have contracted the virus?
You see, we are a hospital with nearly 500 doctors.
Yes.
And 37 doctors out of 500 is really a smallish amount if you look at it in perspective.
Yes.
We also need to understand that not only is Ganga Hospital looking after corona patients from the very beginning. For the last 13 months, we have been looking after COVID patients. And we have been looking at between 100 to 300 patients at one time.
Yes.
And a lot of doctors are exposed continuously to patients who are COVID positive.
Yes.
Then we have patients who come into the emergency with COVID undetermined status and who need to be cared for immediately for their emergency treatments.
Yes.
And their COVID status is exposed later.
Yes.
We also have a large outpatient attendance where there is maybe 1,000 to 1,500 patients on any given day. Plus you have patient relatives who are coming. And don't forget, doctors also have a life outside the hospital. And we have our families, we have our maids, we have our friends. We also go shopping and go to a variety of places. So it's not entirely that these patients got exposed, these people got exposed within the hospital. And many of them have been detected on the basis of contact tracing.
Right. Doctor, so all these doctors who've tested positive now had taken both the doses of the vaccine. Is that right?
That is correct. Both doses, and most of them are over 3 weeks post the second dose.
Right, right. So, what steps has the hospital administration now taken in the wake of these 37 cases now to break the chain, a possible chain of the spread of the virus?
You see, from the very first day, when the first corona patient amongst the doctors came out, at that time, there was an instant message spread around in the hospital groups that whoever has come in contact with me should get himself tested and isolate yourself. Yes. So we actually started preemptively doing all that on day one when the first doctor was detected to be positive. So it hasn't been any delay on that side. On the other hand, there must have been certain factors which have aggravated that suddenly we have a cluster of 37. And part of that could be that with the confidence with vaccine, the people have let down their guard, and that could be a potential problem for the rest of the country as well. That even if you get full vaccination, despite that, you will not let your guard down for at least a year more.
Yes. Dr. Shah, are many of those who've been infected in your hospital, the doctors who've been infected, young? Is there a pattern you are seeing or observing, particularly in this second wave?
Necessarily, a fair number of them are surgeons and some of them are physicians as well. So earlier, most of the infections took place amongst the physicians, but this time a bunch of surgeons have also got infected. And that really does not point to any pattern as far as I can see.
What about the age groups? Do you think that the doctors who've been infected are young, or it's the mixed age group?
It's a mixed age group. Some of them are young and some of them are elderly. And I think one of the elderly has got admitted just because of the age.
Yes. Last couple of questions, doctor. What would you tell the patients who are planning to visit your hospital at this time?
Like we have been very methodical with changing the airflow within our hospital in response to COVID. We have been very methodical with regards to outpatient management and putting up screens, putting up face screens, and carried on doing that was recommended as per the CDC and the Government of India guidelines. In fact, we went a step ahead to change the air conditioning system of the hospital so that we could blow in fresh air into all patient areas. So we have been very preemptive. We have gone ahead and done things which are over and above which was mandated. And I don't see any reason why a patient should be skeptical about visiting the hospital. We continue to do required, continue to do so.
All right, Dr. Shahad, many thanks for joining us. Stay safe as the second wave continues to spread.